Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf Insurance. Our episode today is about endometriosis, a condition that affects about 10% of women, yet it often takes years to diagnose, mostly due to the lack of awareness and stigma surrounding this condition and the symptoms. That's why we're here with Dr. Alphy to raise awareness and break the stigma. Dr. Alphy is a highly skilled gynecologist with over 15 years of experience specializing in advanced and complex laparoscopic surgery, pelvic reconstructive, and urogynecology surgery. She currently serves as the head of Department of Obstetrics Gynecology and Mediclinic Welcare Hospital. She is an expert in minimally invasive gynecological surgery and has performed more than 10,000 advanced minimally invasive laparoscopic and hysteroscopic procedures throughout her career. Thank you so much, Dr. Alphy, for taking the time to be here.
Thank you for inviting me.
So can you start by telling us what is endometriosis?
Okay. Endometriosis means it's a bit difficult to understand. Basically, there is a tissue called endometrium inside the uterus. So that is what, when it sheds, we'll get the menstrual bleeding. Okay. So in endometriosis, unfortunately, these endometrial tissue starts growing in outside the uterus. It can be anywhere, in the pelvis, even in the colon, or even in the diaphragm, anywhere. And this leads to, what happens is when women has a menstrual bleeding, these deposited endometrium starts bleeding and it causes some inflammation, fibrosis, scarring, and this leads to the symptoms. So in nutshell, basically endometriosis means the deposition and growth of the endometrium outside the uterus, which is supposed to be only inside the uterus, and that leads to the symptoms of endometriosis.
So what are the most common symptoms of endometriosis?
So the symptoms, generally, its most common symptom is painful period and like pelvic pain. So those are the common symptoms, but that is why there is a delay in diagnosis, because the symptoms can be related to which organ it is affecting. So women can have, if it is in the intestines, women can have problems with bloating, then diarrhea, constipation, and many a times it is misunderstood as irritable bowel syndrome. And if it is near the bladder, then they can have urinary symptoms like frequency of urination, urgency of urination. And sometimes, like, they may not be having much symptoms, but it is diagnosed when they have issues with conceiving. So mainly it is painful periods, then menstrual irregularities, and bowel symptoms, bladder symptoms, and fertility issues.
So it sounds like it's hard to diagnose because women don't actually visit their gynecologist. So it's because, as you mentioned, the symptoms can show up something in their abdomen, so they would go to like internal medicine or something, and then that's why it's hard to diagnose.
So that is one of the reasons why it is being diagnosed delayed, because generally, even among doctors, like other specialty doctors, the belief is that endometriosis will affect only the pelvic organ, and they present with the menstrual symptoms or painful periods. But the truth is, it can affect any other. It's considered as a whole body disease. So the patient may be visiting a gastroenterologist with complaints of bloating. So, and ultimately it has been diagnosed as irritable bowel syndrome. I'm not saying that it is not irritable bowel syndrome, but patients who have endometriosis have higher chance of being diagnosed as IBS. It can aggravate the symptoms of IBS. And even sometimes it can be a chronic fatigue, or many a times with adenomyosis, which is endometriosis affecting the uterus, they can have heavy menstrual bleeding. With heavy menstrual bleeding, they'll have anemia and go to an internal medicine doctor, and it will be treated as anemia. So that's why the diagnosis takes a bit long time, and that's the like on an average we can say 6 to 10 years of delay in diagnosis. But now definitely, because of lot of awareness programs and people are coming to know about it, and again, so that's why the diagnosis has been happened quite early nowadays.
Would you say that if women, like, they need to do regular checkups with their gynecologist, and then this will severely, like, it will really reduce the time? Because if I'm doing a checkup every 6 months or 1 year, then instead of waiting 6 years for it to be diagnosed, then it would take like 6 months?
See, nowadays, not only gynecological problems, any other health issues can come up quite early. Previously, I can say that when I started my career as a gynecological surgeon, we used to operate on women more than 40 years for this type of conditions. But now, sadly, we are seeing it from the age of 16, 17. The same type of complex endometriosis are seeing at the age of 20. So now it is good to have a general checkup, not only for gynecology, as a health checkup. So, and another problem is patients, they do come with symptoms, but if it is very early, it's really difficult to diagnose also.
Because sorry. Yeah. I was just going to ask, it doesn't show up on scans very easily?
Yeah. So there are different types of endometriosis. If there is something called superficial endometriosis, there is deep endometriosis and ovarian endometrioma. Okay, I'll explain one by one. Superficial endometriosis means the endometrial lesions, it will be there inside, but it is very superficial. It will be like a brown spot or red spot or white plaque like that. So it's very difficult to find out in ultrasound. It's very difficult, this superficial lesions. And even in MRI also, it's pretty difficult to find out. So that's the reason when patients comes with symptoms, when we do a general ultrasound, may not find anything. And even MRI, it's very difficult. And again, reporting of MRI is very important because the radiologist should be familiar with reporting to endometriosis, especially these very small lesions. So when it comes, ultimately, when it comes the imaging reporting, oh, pelvis is, there is nothing is being found. And that is the reason why many a times the endometriosis patients, even though they are in pain, many a times it's been told, oh, it's a normal pelvic pain or normal painful periods. Because by the time it is diagnosed in MRI as some scarring, it may take 6-7 years.
Okay. Is there a cause to endometriosis?
It's
something
difficult
that
to
triggers
say.
it, maybe?
Yeah, there are so many theories being explained why it happens. One of the commonest theories is retrograde menstruation. Means when women has a period, like invariably everybody, when I do a laparoscopy for women, if they finish their, like at the end of their period, I can see blood inside the abdomen. So what happens is the blood like coming out the same way, it can come out through the tube and it will be there in the pelvis. Okay, so some amount of endometrial tissues will be there in the pelvis. And most of the time, because of our natural immunity, these endometrial cells have been cleared. But now, because of some reasons which we are not very clear about, these endometrial cells are not cleared and it starts growing in the pelvis. So maybe we can quote it as an immunological factor triggered by our environmental contribution. So we are not pretty sure what exactly is the reason. If we are definitely sure about the reason, there will be a medical treatment for that.
So there's nothing that women can do to prevent endometriosis from happening?
To be frank, at the moment, I cannot say, but I can just say like a healthy lifestyle with include of like basically anti-inflammatory diet and the diet which keeps you healthy and exercise and all these factors can contribute because see all nowadays because of the stressful life and the overuse of plastic containers and everything is in plastic. So these microplastics and all these are the factors for all other problems also like breast cancer, colon cancer, everything is linked to each other.
Everything's worse.
Yeah. So it's mainly leading a healthy lifestyle, try to avoid whatever is possible from our side. I cannot pinpoint and say, oh, this is the reason for endometriosis. That as of now, I cannot say. Maybe after 10 years, God knows, maybe we'll have something in hand.
Hopefully. So once a woman is diagnosed with endometriosis, what's the treatment plan or is there a cure to it?
Okay. So when it is being diagnosed, so we'll start like suppose for example a 14 or 15-year-old girl coming to me with painful periods and an ultrasound has been done and an MRI, not much has been found out. At that point, I may be suspecting endometriosis. So in her case, it will be a symptomatic treatment. I will not right away go for a surgery to diagnose it because even if I diagnose by laparoscopy, she may be having mild lesions. Even if I remove it also, again, it will come back. So that's why at that moment, I will be putting her on medical management, basically the symptomatic management. If it is pain management, and sometimes hormonal medication to prevent the progression of the disease. Then next, when it comes to if the ultrasound or MRI showing an ovarian cyst and deep endometriosis, then we will see how is the cyst size. If it is not very big, again, if she is not planning for a pregnancy, we can offer the medical management and we can continue with that with regular monitoring. When it comes to if it is a cyst is big and there is lesions on the bowel or like bladder, which may not resolve or even the symptoms may not get controlled with the medication, then we go ahead with laparoscopic excision of endometriosis. And for some women, it may be for the fertility reason, because of the scarring, the tubes can get blocked, and because of the chocolate material in the ovarian cyst, that can be toxic to the embryo. That's why they are not conceiving. In those cases, we go for a fertility enhancing surgery, basically removal of the endometriosis as much as possible. So to narrow down, the treatment basically depends upon the age of the person, symptoms of the person, and what is the like how much is being affected, like whether they need a surgery or a medical management. And many a times, because it's as you asked whether there is a cure,
Yeah.
sadly again,
Not
surgery
yet.
is not a cure completely. We can clear what is there now, but again, when she starts getting her periods, there is a possibility that it can come back. So most of the time after the surgery, we put them on some medication so that it will not come back that early. The recurrence can be delayed.
So has ever one of your patients, like after the surgery, they had no growths of these lesions, or is it just kind of you slow down the growth?
Again, there are so many factors, because I have seen in like the recurrence is more common, more fast in younger age group, because younger age group, the ovary activity is much higher, estrogen production is more, so the recurrence is also much faster. But the same, if I do a 45-year-old woman, the endometriosis, again, like cyst is removed and ovary is kept back, because at that age, the estrogen production is slightly on the low, so the recurrence may not be that fast. So it depends on so many factors. Some I would think, oh, it can recur, but it may not recur. Some I feel, oh, I have done a very good surgery, all the lesions have been removed, but if she's not on the medications, it may come back pretty early. So certain things, even like nobody can explain on this.
So endometriosis is not related to a specific age group. It can affect women of all ages.
Yes. So generally, one of the misconception, I wouldn't say it's a misconception, it's a truth to some extent, that with menopause, the endometriosis subsides and it will go away. So when women is around the age of 50 or 51 and like they are still not menopausal, we try to push, okay, till your hormones stop, like we can postpone the surgery like that. But even after menopause also, the endometriosis can grow in certain cases. I'm not saying in everybody, some cases. And even after menopause, if suppose a woman has a 6-7 centimeter of ovarian endometriosis, and she reached menopause, but still we need to monitor, because these are endometrial cells in the ovary, and they have a risk of 2 to 4 times risk of having ovarian cancer compared to a person who doesn't have an ovarian endometrioma. So it can happen to any age group, because nowadays kids are having periods called menarche very early. By the age of 10, they are having periods. So that is the reason they are getting endometriosis very early. Even at the age of 12, 13, we start seeing the symptoms with endometriosis.
And this is only recent in the recent years. In the past, it wasn't like that.
It was. There was,
but it wasn't
actually
diagnosed?
Yeah. One thing is, this much of awareness was not there, even among doctors. For example, as I told, in 20 years back when I started, at that time, endometriosis or adenomyosis, we find it only when we plan them for hysterectomy. That means by the age of 45 or something like that. Then again, after 5 years, when we are doing laparoscopic surgeries, we didn't had much awareness about the colon endometriosis and MRI reporting, all those things. It was all during the surgery we find out. Now things have been improved. Now we know what we are going to do. A surgeon and a radiologist will know what is the finding before going for the surgery itself. So it's the awareness among the doctors have improved, so better diagnosis, awareness among the patients it have improved, so that they don't think, okay, I'm having period pain, it's a part of normal life of a woman. No, that awareness has come, and so they approach doctors and diagnose a bit early. And again, yes, because of lifestyle and when the environmental factors, it is like coming early age group as well. So all these are the contributing factors of increasing number of endometriosis.
So what is the impact of endometriosis on a woman's life? Like not from just the pain and the heavy periods, but is there something that she can't do from a lifestyle perspective?
Okay. Endometriosis, it can affect every part of women's life. For example, starting from a schoolgirl, when she's having her period and pain, again, she cannot go to school, she cannot focus on her studies, and that is one thing. And again, when she is into work, after she finishes her college and like into the work, when she's in pain, it's not only the pain, it can affect her mood, it can affect like her like brain fog can be there, so decision making, it can be affected, so it will affect her work life. And and even if we say, oh, I have endometriosis, I have period pain, nobody can understand that unless that the person is suffering. Like only she can, but surrounding people, they may not understand the impact of what she is suffering. And when it comes to the marriage and fertility, many a times women with endometriosis, they have dyspareunia, means having painful intimacy, and this also can impact their marriage life. And again, when it comes to fertility, there can be a delay in becoming pregnant, and they have to go through a lot of fertility treatments and those stress and mental trauma. It's a lot actually.
It's a lot of, it's a lot of impact. Okay, you speak about pregnancy and fertility treatment. So it is possible for someone with endometriosis to get pregnant naturally, or do they need to go for like IVF? Or?
Okay, so endometriosis, it doesn't mean that their fertility is down. No, because many a times, like most of the time they conceive naturally. Like when they come for pregnancy checkup, we see, okay, there is endometriosis, but still she's like conceived and having children. And sometimes it will be very mild endometriosis, but they may not get conceived also. So nowadays, because the earlier age group we are seeing, the ovarian cyst, or if they are like if they need a surgery, we do tell them, okay, you have endometriosis, so you can consider going for egg freezing. Because nowadays, women, because they are career oriented, they're studying, they start a family life quite late. So by the time maybe they are planning for a child at the age of 35 or 38, one thing is the quality of egg goes down. Again, the ovarian reserve goes down. So we tell them, okay, if you have endometriosis at 25 or 28, think about egg freezing, so you don't have to worry even if the disease is there. And it's not that IVF is the to go for pregnancy. No. If they are not conceiving, it's a step-by-step thing. If they are not conceiving naturally, we try with some other medications and like that. Again, there is a delay. And if the age of the patient is going up, reserve is low, if they have a severe endometriosis, then we do say, okay, try IVF, because you don't want to waste much time on this.
Okay. But if a woman gets pregnant and she has endometriosis, is it like a high risk pregnancy? Does it have any impact on the baby, or?
Okay, so most of the part is in conception. Once conception is over, yes, there can be slightly increased risk of early miscarriage. And then later on, it will be mostly like a normal pregnancy. Very rarely, if somebody has adenomyosis, then they can have some like pregnancy related issues. But otherwise, when they are pregnant and the first trimester is over, most of the time it will be like a normal pregnancy. We cannot say it's like okay, you will be high risk, not like that.
Okay, and with delivery also, there's like nothing out of the ordinary?
No, if they have conceived either naturally or by IVF, unless there is some specific reasons like baby's position is different, or not because of endometriosis, otherwise
just also normal.
Yeah, otherwise they can go for a normal delivery, and the rest is everything like others.
Okay, because I think this is one of the common misconceptions about endometriosis, that if a woman has endometriosis, then either she can't get pregnant, or at least not naturally, and then like it becomes a high risk pregnancy and all of this. So
okay, no, absolutely not. They can. But as I told, it's a tailor-made plan for a different individual. It's a different assessment, and based on their individual situation, we decide.
Okay. Is there any research in the field about cures or treatments that you find promising?
At the moment, there are a lot of researches going on. For past 20 years, I can say a lot of researches are going on. But there is a slow growth. For example, initially it was imaging modality is the diagnosis, but now we have salivary mRNA. Means with the salivary test we can diagnose whether the patient has endometriosis or not.
Wow,
that's a very good thing, because 5 years back, 10 years back, it was like diagnostic laparoscopy is the gold standard for diagnosis. Now, not laparoscopy. We can diagnose with imaging, and now it's the easiest way is to salivary mRNA. But unfortunately, in UAE, the problem is it's a bit expensive test and it's not covered by insurance. So maybe in future it will be, and then things are much more easier.
Yeah, absolutely.
Okay. And coming to your question, whether there is any promising, maybe some genetic markers or immunological treatment may come up. Researches are going on, and with AI-driven imaging reporting, maybe it can be, because now it's basically dependent on the radiologist's experience and expertise in reporting. So with AI, maybe it can be, the diagnosis can be made a bit more earlier, and early, where small lesions also can be picked up pretty early. So maybe.
Maybe.
Yeah.
Yeah, we hope so. Okay, are there any misconceptions about endometriosis that you would like to, correct?
Okay, misconceptions basically when it comes to one question like you already asked, like whether the IVF is the, or means whether they cannot become pregnant. No, as I told them. Second thing is people think dysmenorrhea or heavy periods is the symptom of
Normal.
endometriosis. Yeah, normal, that is one. And again, this is the only symptom, but they can present with so many other symptoms. And so that is another thing. And again, it's endometriosis, as time passes, women can have like chronic pelvic pain and other symptoms. So these are the common things what I come across during my consultation.
Okay. Any tips you would like to share with our listeners?
Tips, three things. One, I know nowadays, because people are a lot into ChatGPT and this thing, even before they consult us, they come with a diagnosis and they say from, and one thing what I would say is, because of lot of information, even if they don't have endometriosis also, they come up with the symptoms of endometriosis. That is one thing which I do see nowadays. Okay, so one is, look, if you have symptoms of endometriosis, meet a specialist who is like a center where there is like, they are more a team working on it. Okay, so that again, it will be the specific treatments and diagnosis will be appropriate. And again, we don't need to get worried that there is endometriosis. I know there is no cure as of now, but we can manage the symptoms and cure and prevent the recurrence to some extent. So it's not that something incurable. It is.
It's manageable.
Yeah, manageable, yeah.
Okay, great. Thank you so much, Dr. Alfie, for being with us today. This was
Thank you. It was a pleasure
very
for me.
informative. Thank you. To everyone listening, thank you for tuning in. Women, please, if you're experiencing any symptoms, go get checked, and please help us raise awareness by sharing this episode with your family and friends. The Health on Track podcast is available on YouTube video and music, Spotify, Apple Podcasts, and Rami and Amazon Music. Stay well and keep thriving.